Hello, Assalamu alaikum. Good evening, everyone. How are you guys doing? This is Dr. Zaib Qureshi. So, how's everyone? hmm I hope my voice is audible. Hi. Okay, that's brilliant, Sidra. That's brilliant. And N, who is this? Okay, Hind, very good. All right. Hi, hi, hi. Good to have you. Good to have you. Hi, Kim. How are you doing? Reham, Azwa, Uzma, and everyone. Okay, brilliant. So today we are going to have an overview about the MRCOG Part 3, how we are going to start our preparation and how we are going to go about it. And of course, I'm going to give you, the complete idea that how you are going to start your preparation and everything. Okay. So meanwhile, if you guys have any kind of question, you can, the post in the chat box, or even you can ask me in the end of the session as well, or wherever you feel like. Okay. And yes, and just one request, make sure that your mics are off, and because sometimes it poses a lot of the problem in the connection as well. Okay, so first of all, congratulations to all of you who have just passed their part 2, and now they are heading towards the final destination to become MRCOG, isn't it? MRCOG part 3. So yeah, this is such a big achievement, I must say. Okay, because now you are just close to become MRCOG. And in this MRCOG part 3, of course, you have just crossed the bridge, part 2, and now you are going to, cross your journey as well. And then you are going to become MRCOG, isn't it? So first thing first, we are going to talk about that, how long you are, they're going to go for this exam, how many attempts are going to be there. And this is what, we all dream of. Okay, this is MRCOG, the building. This is on Union Street, the close to the London Bridge, and this is in London. And this is the MRCOG building. Okay, and this is where every MRCOG aspirant, they want to be there for the convocation or for any other thing. But of course, many of us, in fact, all of us, I mean, really want to go there to attend the convocation, to be part of the convocation ceremony. So this is where you are going to, the head after your final exam. And before, the talking about that, how, you are going to start your preparation. First of all, let me tell you that you have to attempt part 3 within 7 years of passing part 2. Okay, so you have total 4 attempts, and you have to pass all four, you have to pass within 4 attempts. Okay, and this is very unlikely that candidates, they are going to go for, the total four attempts. If your direction is, the good, if you are, the going into, what you can say that, in a focused way, in a good direction. So yes, it is easy to pass in first go. Okay, and even if not in the first go, so within 4 attempts, I mean, one can easily pass. Okay, all you need to do is that you just have to give your best, you have to prepare in the right direction, you have to follow the instruction. Okay, and you have to start your preparation dedicatedly. Then what is the aim of MRCOG part 3? Okay, so this is what, we all, they look for. The aim of the part 3 exam, I mean, after just thinking of to become MRCOG, this is the aim of the part 3 exam, is to assess the candidate's ability to demonstrate core clinical skills in the context of the skills, knowledge, attitudes, and competencies as defined in the MRCOG part 2 curriculum. Yes, of course, you need 4 years experience as well. It's not after, it can be after, before part 2 as well, it can be after part 2 as well, doesn't matter. Okay, so everybody has a different, the journey, everybody has a different, the kind of race. So many people, the who already have their, the training or residency, and many of us are in the training programs in our respective countries. So this way or that way, you need to have total 4 years experience. Okay, So with this total 4 years experience, of course, you can go for this part 3 if your, what you can say, the eligibility is confirmed and your assessment of training has been approved by the college. So yes, you are ready to go. You are ready to go for your part 3. And of course, it's a final step in becoming member of the prestigious Royal College, isn't it? And this is what we get, this blue and white, the black gown. This is going to be the cap, and I think this is going to be a kind of dream, okay, for every candidate there is. First of all, the before entering into the system, you need to understand the training system as well. Okay. First of all, because in the part 3, what you are going to do is that in part 1, what did you do? You had your basic, the knowledge. Okay. You had your what you can say, the core knowledge. Then in the part 2, what you had your the clinical knowledge, theoretical knowledge. In part 3, that is going to be the exam. Now this is going to be the clinical assessment. Okay, so while you are going to prepare yourself for part 3 exam, so either you are going to be the by rule. Okay, this is the training matrix. In here, by rule, a person, a candidate who is a specialty trainee year 3 or 4 or 2, they are eligible to go for this part 3 exam, and it is must for them to the pass MRCOG this way or that way by the end of their ST5. So what happens is that, specialty training and education program in UK is going to be the foundation training. This is going to be a foundation year 1, foundation year 2. This is going to be training in the women's health. This is going to be somewhat equivalent to the internship, what we do in our countries. Okay. And then they will enter into specialty training program. ST1 year 1, ST2 year 2, 3, 4, 5, and by the end of ST5, then you are going to be expected to pass your part 3 MRCOG as well. So see, by this, you are having 4 years clinical experience, isn't it? So for the all overseas candidate who are entering into this exam, so this way or that way, the almost, you can say the 75% already are, the kind of having their, the respective training, okay, for 4 years for their own, the boards, for their own, the colleges, postgraduate, whatever. Okay. So yes, I mean, you can have, as an overseas candidate, you can have training before entering into part 2 or even part 1. Okay. And then you can go one after one to all exams. All right. And if somebody is very raw, if somebody is very new, so what he or she can do is that you can write part 1, part 2 right away, then get into training system, get your 4 years training, and then go for MRCOG part 3. So we have got couple of ways. Okay. So but remember that by the end of specialty training ST5, RCOG expects that every trainee has had finished their part 3 MRCOG. Okay. So if you are not part 3 MRCOG passed, and if you haven't done this, then you are not going to go for advanced training, which is going to be ST6, ST7. ST6 means then you are eligible to choose your, the desired training specialty. For example, many candidates, they want to go into fetal medicine. Many candidates want to opt urogynecology, oncology, subfertility, maternal medicine, this, so and so. Okay. So this is going to be like this, but initial 5 years you have to spend in the core training. And ST1, ST2 is going to be basic training. From ST3 to ST5 is going to be the intermediate training. Then ST6, ST7 is going to be the advanced training. So by this, you are going to enter into, the advanced, the training matrix, and then you can choose your subspecialty. All right. I hope it is making sense to all of you. So yeah, part 1 to be completed in ST1, ST2 required for progression to ST3. All right. So by rule, this is college, the curriculum. So part 2 to be completed by ST3, ST4 or ST5 required for progression to ST6. So part 3 is completed to be ST3 or ST4 or 5, and after part 2 MRCOG eventually, so required for progression to ST6. All right. So I hope it is clear. So because many of us, of course, are not working in UK, so we are, not familiar with the UK training system. So this is how it is going to be. So while you are going to start your preparation for part 3, you are going to expect questions that you are ST3 training, the trainee working in the department, or ST4 working in the department. So this is how you are going to be addressed in your part 3, the questions. So curriculum is very important. So overall, the RCOG is going to expect CSR is a very different route. So after part 3, why you are going for CSR? Directly write your OET or IELTS and go for jobs, specialty training. Look for specialty training. Okay. So this is how, you can go. So CSR basically is going to be, the GP route. If you want to go for GP route, then why are you, putting yourself into that much of hurdle? Okay. Why are you putting, that much into hurdle of going for MRCOG and all right. CSR is a very, the difficult, and because in CSR you have to get your all, the competencies signed from your own respective country. Then you have to submit it to your, the respective consultant in the UK, and then if he agrees, if he, he allows, then that is going to be signed. So I think it is going to be a pretty long journey. Rather, to enter into the UK system, you have two routes. Okay. So I think this is going to be helpful for everyone. Two routes. One is PLAB route. So PLAB route is very basic. In that, again, you have to write PLAB 1, then you have to go for PLAB 2 as well, right? And then you can get your GMC done, and then you can look for your jobs. And jobs are going to be pretty basic. Okay, you are going to start from foundation year training. All right. So make sure that you are, ready to start your training program from house officer, okay, or internship, what we do in our countries, right? So after PLAB, you are going to be eligible for foundation year training. And the second route is MRCOG. Of course, we are in MRCOG or MRCS for surgery people, for MRC, the P for the medicine, or this way or that way. So this is how, you have to go. After completing this MRCOG, you can, go for GMC registration, write OET or IELTS, okay, English language competency. And after that, you can become GMC and look for jobs. And after looking for jobs, this, the GMC, you are going to be expecting, the entering into the basic training system. If you have, the good experience, or if you have applied for almost, the plenty of jobs, and if you have been shortlisted and been lucky enough to score the job, then directly you can enter into specialty training system. Okay, ST1, ST2, or ST3. It depends upon. Okay. So this way or that way, it takes, the time, it takes, a lot of effort. And of course, once you are switching from one system to the other system, so you need to be, the equally competent, you need to be equally, what you can say, the ready to take the burden as well, because switching is never easy, isn't it? So I hope it is clear, whoever it is. I'm sorry, your name is not there. So of course, the RCOG is going to judge you on the core curriculum, onto the 14 capabilities in practice. Okay. So the 10 are going to be the generic or the professional capabilities. And with each CIP outlines the key skills you will be expected to have, because you are going to write into the part 3. So first of all, it is going to be the professional identity number 1, in which, you are going to be judged on as a healthcare professional. Okay, that a doctor is able to apply medical knowledge, clinical skills, professional values. The doctor is able to successfully work within the healthcare organization. The doctor is a leader who has a vision, engages, and delivers results. The doctor is able to design and implement quality improvement projects and all. Okay, so this is going to be one competency. The second is going to be the doctor is ready to take an active role in helping self and others to develop as well. The doctor is able to engage with research and promote the innovation. The doctor is effective as a teacher and supervisor of healthcare professionals as well. So. Okay. Then you are going to have, the progress. Every trainee will have a progress. There is going to be, the levels. Level 1s, when you are just interested to observe, when you are interested to act under direct supervision. Level 3 is going to be under indirect supervision, then independently with support, and independent. Level 5 is going to be, the independent, the working trainee. So these are going to be, the capabilities in practice. So this is how it is going to be. ST1 expected to have all these competencies. Okay, that, at least they are ready to handle, ready to take history examination. Okay, and they are recognizing and assessing and managing the emergencies and obstetrics, non-emergency gynecology, and early pregnancy. At least they are recognizing and assessing. Means they are, capable to take, the histories and all. Okay, so this is going to be level 1, which is mean observing. Level 2, ST2 will be able to do this. ST3 will be under direct supervision. ST5 indirect supervision. Okay. And ST7, of course, the independent itself. So this is how, the RCOG expects everybody to go along. Okay. For example, endometrial biopsy. Okay. Endometrial biopsy, ST2 can take, cervical smear, ST1 can take, insertion of IUCD, IUCS, IUS, ST2 can, from ST2, it's okay. Vulval biopsy will be done by the ST4. Surgical management of miscarriage or surgical termination of pregnancy, ST2. Okay, hysteroscopy is, the ST4 domain. Diagnostic laparoscopy is going to be ST4 domain as well. Okay, so and so, these are going to be the competencies level. These are designed by the college, basically. For example, perineal repair. Perineal repair is going to start from, this is going to be ST2. They are going to expect that, either you are having, the different levels, okay, level 1, 2, 3. So of course, ST2 will be at least at level 2 or 3. Okay, so this is perineal repair. Third degree perineal tear repair is going to start from ST4. Non-rotational instrumental delivery from ST2. Rotational ST5. Okay, cesarean section basic, the simple one without any complications or risk factors, ST2. Cesarean section intermediate, ST5. Complex cesarean section will be, towards the higher, the kind of advanced training skills. Manual removal of placenta starts from ST3. And so scan, basic scan, transabdominal scan, ultrasound of the late pregnancy will be done by the ST3. So these are going to be, the matrix of progression. So of course, ST1, ST2, ST3, ST4, ST5 will be signed off for everything. Okay. And then they are going to have, the different exams, right? So summative and formative assessment, we all are well aware of, right? So in summative assessment, we will have two results, either pass or fail. So with every exam, we are going to get our result. Part 1 is basic and applied sciences. Part 2 is clinical knowledge. Part 3 is clinical assessment. All right. Then there is going to be OSAT, objective structured assessment of technical skills. Yeah. So this is also going to be, the summative. This is going to be signed by our supervisor, whether we have, done good and then pass, bad, fail. Formative assessments are going to be a couple of, the others, like, the case-based discussion, mini-sex, so and so. This is going to be like this. Okay. So MRCOG journey will be like what? We pass MRCOG, we head to part 2 MRCOG, we pass part 2 MRCOG, then we are entering into our, the last final destination, part 3. Prepare now. Okay. So I hope that training matrix is clear to all of you. Is it clear, everyone? Any question? Training matrix is clear to all of you? If not, you can directly go to RCOG website, and this training matrix is, available over there. Okay, you can always download, and you can always go through just to understand the system, how you are going to go about it. All right, great, Sidra, very good. All right, let's move on to how this exam is going to be. All right, how this exam is going to be, what is going to be the pattern of exam. So first of all, you need to understand. Okay, so now if you want to simplify for yourself, you can also write it with you. If we have 5 years experience, it will be added on. No, no addition. Okay, you just need to write 4 years to part 3. That's it. There is no addition. Okay, there is no addition, no subtraction. You are just entitled to take exam and nothing. You are going to start from scratch. Okay, in UK system. All right, for the pattern of exam, there are going to be total 14 stations. Okay, 2 minutes is going to be, the reading time. And in online exam, it is going to be 2.5 minutes. All right, half minutes is going to be for switching. This we call it as reading time. All right, then you will go one after one into the cubicles, and 10 minutes is going to be your performance time. Okay, we call it as performance time, reading time and performance time. Yes. So after 10 minutes time, you will enter into the new cubicle. You will start reading another question, and then so and so. 5 and 6 are going to be the structured discussion. Rest are going to be the role plays. Out of them, 4 are going to be with the lay examiners. All right. Examiners are going to be of the two types in here as well. Okay, one is going to be the clinical examiner, and one is going to be the lay examiner. Lay examiner are the laymen, the people. They are not doctors, they are non-doctors. They are just going to to observe how you behave, how you interact with the patient. For example, if it is a kind of the way you have to deliver a news, so what is your tone, what is your pace, what is your choice of words as well. So lay examiners are going to be like, expecting that a candidate is ready to enter into the system. In the face to face exam, there is not going to be any rest station. However, there is going to be the one rest station in online exam after 7 stations for about 15 to 20 minutes. But in that 15 to 20 minutes, you cannot leave your computer, you cannot leave your camera, you can't go to loo, you can't eat anything, you can't drink anything, or cannot do anything. Right, you are going to be sitting over there. That's it. Okay, just the rest, just rest your neurons, just be in front of camera all the time. So overall it is going to be 168 minutes and it's going to be over. However, in online exam, it can be little bit more. Time can be little bit more because we are dealing with technology, and there can be any problem at candidate side, at role player side, or the examiner as well. Okay, for the all these exams, there is going to be online exam, there is going to be the face to face exam as well. Like in this February, we just had online exam. Okay, just one moment please. Sorry. So like in this February, we had only online exam, right? But in May exam, so we are, expecting to have face-to-face exam and online exam both. So, but still, we all are waiting for, the what college decides, and the how they are going to, they send us, the emails and whatever the news there is going to be. So virtual exam is going to be like this. We are going to be dependent on, the internet, and it is going to look like this. And the for the virtual exam or the online exam, what you need to do is you need to have your good system. Okay, you have to take your exam on desktop or laptop. Okay, you can't take exam on your mobiles, your MacBook, or the anything. All right, so make sure that you are having the Windows 7 or newer one installed, or if it is the Sierra, then 10 point, or the 1.2, or even the newer version. Google Chrome should be your web browser. Okay, no Opera Mini, no the Firefox, or no other web browser. Okay, it should be Google Chrome. So make sure that your Google Chrome is up to date. Make sure that you are having desktop, laptop, but not the mobiles or anything else. Then over the headphones should be there. Okay, because they are going to they decrease the sound if you are in online system. Make sure that you are in a very the good room where there is no the extra noise, and the you are the in one room for good the like kind of, you can say, 7 to 8 hours alone. Okay, for Osler system, you don't have to download any system. You will just log in with your given details, and that's it. You are going to enter into system with the login details. You just need to have this Chrome with you. All right. First of all, a laptop or desktop, then a Chrome with you, and Chrome should be up to date. Chrome should be installed, and every permission should be given to the the your system. Okay, so it means that if you are using Wi-Fi, if you are using this Chrome for the Osler system, so make sure that you are giving permission from your the basic system for the microphone, for the camera, for the recording or whatever. All right, and the internet you are using, so it has to have the good broadband as well. Okay, and even if it is fiber internet provider, so it is very good, because you have to have the good bandwidth, and you have to have good speed of the internet as well. So on the day of exam, you are going to expect like this. You are going to log in with your given details. You are going to enter, and you are going to check system. System is going to ask you that, okay, check camera setup, check microphone, check connectivity, and the Wi-Fi. Okay, the same rehearsal will be done, the 2 to 3 days before exam as well. Okay, RCOG is going to ask you to do that, and then you are going to expect, this screen. You are going to see this screen. Okay, then you are going to enter into, the one waiting room, and then your exam will start. 2 minutes reading time, then 10 minutes exam time, and then this same will repeat for 14 stations, and that's it. Okay, so this is going to be in the online system, and once you are going to be done with your exam, you are going to log out. Okay, you are going to log out, and that's it. Now your exam is done. You are just going to sit back, relax, and wait for the result later on. Okay, and if at all you have had bad stations, for example, you had a bad connection, you could not see the screen, you could not hear the role player, you could not, hear the examiner, so you can go for appeal. Okay, you can go for appeal, because every candidate will be observed by the chaperones. Okay, those are going to be the technical people from RCOG, and the RCOG will closely be observing every candidate. All right, not only the technical people, but the examiners as well. Okay, we call them as reserved examiner, clinical examiner, then reserved examiner. So in online exam, you are not going to be examined by only one examiner, rather maybe one, two, or three, and those are going to be in the background. Nobody will ever come to know that who is observing. All right, so this is how you are going to be in the system, and this is how you are going to see on the screen. Okay, this is you, means candidate. This is going to be your station number 123 so and so. This is how you are going to see the instructions on the screen, and you will be given command to the scroll up or scroll down through this, and here you can write your own notes if you really want to. Okay, if you want to write down anything from the questions, any important thing, so this screen will be visible to you throughout this time, and then you can easily see that. For example, this is role player, this is your examiner, this is you yourself, and this is your screen where you have the noticed the everything. So it is going to be visible for you for next 10 minutes as well. But in the face-to-face exam, I'm sure everybody is familiar with all these face-to-face, because we have always been into these kind of exams throughout our life. Okay, so starting from the basic graduation level, so this is going to be from one room to the other room to the other room to the other room, and this is how it is going to be. All right, so you are going to be asked to move from one room to the other room. All right, and you will have case number 1, case number 2, 3, 4, 5, and so and so. In face to face, there is no rest. Okay, let me clear this thing up again. But in online exam, there is going to be the rest for 15 to 20 minutes after 7 stations. Okay, after 7 stations. But in those 7 stations, you don't have to log out from the system. You are going to stay there. Okay, you are going to stay there. You are just going to wait for the next 7 stations. That's it. Okay, so no rest station. All right, clear up till now, guys? How exam pattern is going to be online and face to face. Clear, everyone? Mm-hmm. All right, great. All right, and now we are going to talk about that, how we have said that, there are going to be 14 stations, right? So every 14 stations will have, some kind of domains on which we are going to be tested. All right. So from those domains, there are going to be information gathering. Information gathering is similar to what we all are familiar with, history taking. History taking. But in MRCOG, we call it as information gathering. Then there is going to be communication with the patient and relatives, and communication with colleagues. Then this is applied clinical knowledge, your part 2 study, right? And this is going to be blended with patient safety. Okay, because if your applied clinical knowledge is thorough, if you are the well read with the guideline or talk article, then yes, you are going to apply your applied clinical knowledge, and of course some of these safety points are also going to come from them. All right, remember, each of the 14 tasks will assess between 3 and 4 of the domains to reflect everyday clinical practice. For example, communication with patients is going to be linked with the applied clinical knowledge, or communication with the colleagues also involve aspect of the patient safety as well. For example, you are ST3 and you have been asked to assess this woman and take consent. So yes, you are ready to go for that, because you are signed for the patient's consent. But if somebody is going to ask you that, okay, perform vaginal hysterectomy, so of course that is not your domain. So what you are going to do? Of course, you are going to say that, okay, I'm going to involve my consultant. So that is going to be your applied clinical knowledge. And of course, this is biggest patient safety, that you are not going to perform the thing which you are not capable of and which you are not signed off for. Okay. So of course, that is going to be blended with patient safety. Doing the right thing to the patient at the right time in the right domain, that is going to be, the biggest, the good, safe doctor. Okay. So how to succeed in part 3? You need to look confident. You have to appear as a safe doctor, what we I have just, told you. You have to be logical and organized. You have to be sympathetic and empathetic as well. Means, you need to show some sympathy. If somebody is crying in front of you, okay, don't just, the ignore it. Okay, just you can simply say, I'm so sorry that you are going through this way. I'm so sorry that, I've been the bearer of this news. Okay, this must be terrible, Mrs. Smith. Okay, I can see that, this is so bad, that you are feeling this way. I'm so sorry. Okay, so at least you need to show some sympathy, but at the same time, you need not to go into those emotions where you are going to start, the crying yourself. Okay, you need to be patient and an active listener. Active listening is a key for this exam. If you're not going to listen to the role player or the examiner, you are going to miss, the couple of important information there is. You are going to miss, the couple of important cues if you are, the swaying here and there. So you may miss those important information from, the role player, because 90% of the role player are there to guide. Okay. And hardly ever, the 5 to 10%, sometimes they can be a little bit, stubborn, or the somewhat, the unhelpful. But most of the time they are helping. They are, the helping the candidates. They are going to give you directions. They are going to give you the cues. So this is your job. If you are not, the active listener, so make it a habit from now onwards, that, if you are working in hospital, try to talk to the patients. Okay, try to listen to them. Okay, try to listen to them, try to absorb what they are, telling you. Then, rephrase it into the simple understandable language, and your tone should be very polite as well. Polite enough, for someone to understand, polite enough for someone to get convinced for something, polite enough. But of course, at any point you need not to offend anybody. Okay, not the examiner nor the patient as well. Okay, so make sure that you are not having offensive tone. And because this tone for the communication, tone is always, the countable. Okay, change your character, and the candidate should be able to embed in the role of a doctor in any specialty at the time of station. For example, one station was, the maternal medicine. It was a very good station. The other station was oncology, and it was breaking bad news, that you have to break the news to the woman about the cancer on the histopathology. So yes, we all are humans, isn't it? We all are humans. Sometimes we do feel, sometimes, we do react, and we do overreact as well. But at the same time, in the exam, what you need to show is that, okay, yes, I'm a good doctor. Okay, and I can see, the many and, the several kind of patients in one, the clinic, and this is what we do. One patient is diabetic, other patient is okay, the third patient is cancer, the fourth patient is having polycystic ovaries, the other patient is young, other patient is old. Okay, so we do get variety of patients. So likewise in exam as well, you will get, almost all, the variety out of, the 14 modules in the form of 14 stations. Then let's talk about reasons to fail part 3. This is also important, because we always need to look at why we fail exam. Okay, because of course, like we said, all exams are summative, right? We do get only two results, either pass or fail. There is no intermediate result, right? There is no borderline or something. All right. So what you need to do is that you need to prepare yourself for exam, of course. And the result is going to be dependent on your final day performance. Doesn't matter what you have been doing for the, the couple of months. Doesn't matter if you have been, the so good. That is not going to be countable at all. What is going to be counted is your performance on the final date. Okay, day of exam. So if you are not performing, on that day, so I mean, of course you are losing it. You are losing it, isn't it? So but for part 3, because it is extremely different from part 2, in part 3 what you need to do is you have to practice. You have to practice, the all stations, because whatever you have studied so far in part 1 and part 2, and now this is going to be the time. where you have to show your capabilities and the capacity that okay, I'm a good fellow and I'm ready to move in to the system. Yeah. So reasons to fail part 3. Number 1, failure to have a persistent and consistent daily practice. Believing the myth that knowledge will not be tested, or believing the myth that pure knowledge test or just communication skills. Because many people, many candidates do what is that okay, they really love to perform only communication tasks. They don't want to perform structured discussion tasks. Okay. Structured discussion is going to be with the examiner. Okay. So that is going to be pretty, the basic, and that is going to be based on, the guideline or TOG article. Okay. So prepare for both type of station, because you have to pass exam, and 14 stations are part of your curriculum. If somebody is using too many jargons, somebody is using so many fancy sentences, okay, very difficult, the English, grammatical English, okay, so of course then you have to train yourself. But this way or that way, your communication should be flowy, it should be very easy, it should be understandable. Okay. So jargons is that when you are using so many different terminologies to the patient. For example, Mrs. Smith, I'm afraid that you have been diagnosed with the endometrial cancer stage 3. Okay. And the stage 3 means that now you are the narrating the staging into what you have been the taught, what you have the read so far. However, while you are going to explain anything to the patient, what we do in our day-to-day practice, okay, we do bring, the easy terminologies, isn't it? Easy, understandable, the phrases, isn't it? Likewise, for this, the part 3, you are going to use, the couple of easy sentences as well as phrases as well. Okay. For example, um, for the uterus, you are going to say womb. For the ovaries, ovaries are going to be ovaries. Okay. For the vulva vagina, you are going to say that area down below. Okay. For the abdomen, you are going to say tummy. For the pelvis, pelvis is going to be pelvis or lower tummy. Okay. Or for example, the if it is the peritoneum, you are going to say the lining wall of the tummy. Okay. So all these terminologies needs to be familiar with, and all these terminologies are available on RCOG website. Okay. If you are aiming for part 3, start reading all these things today, from today onwards. Okay. Download them, print them, or keep them saved with your the gadget, whatever you are using for yourself. Okay. And start reading them, start practicing them. Then this is the the biggest failure, I'm sorry to say, for every candidate, there is for every exam, you know relying on the courses and material gathered from here and there. Okay. Courses are designed to help you, courses are designed to guide you, courses are designed to give you the accurate and the right direction. Courses or material, they keep you in the pace, in the right direction. But of course, none of the course, none of the the mentor is guaranteed to sail you through to any exam. All right. Like I said earlier, that exam performance is going to be based on your final exam day performance result, in fact. Okay. So don't rely on that. Okay, I have taken 1, 2, 3, 4, 5, or whatever courses available in the market. So yes, I'm surely going to pass. Okay. It may help you to some extent, but I mean, how you are going to pass once you are going to be in that, the you can say, the flow. Once you are ready, once you are, the prepared enough to go for this exam. And for part 3, relying on ready-made templates. Templates mean how I speak to some station, how someone else speak to one station. So what I'll be doing is that I'll be making my own template for myself. Okay. And the for example, if I have made 100 templates, so those are my thoughts, those are my sentences, those are my wordings. Okay. So if you just want to memorize these words, these sentences, these lines, so somehow it is going to be not good for you. Okay. Don't rely, just try to get the idea, innovate your own sentences, because everybody has the different capacity and capability. Okay. Don't rely on anything, just take help. All these courses material are help, all mentors are ready to guide you, they just guide you. Okay. They can just give you their you can say the experience. Okay. They can the transfer their the knowledge. Don't think that, I cannot go for this exam because I cannot do it, or overconfident as well. Oh, this is nothing for me. I'm just go. I will just go and I will just ace exam like this. Don't be, the overconfident as well. Okay. So the candidate, if they have, the good applied clinical knowledge, so it's better to start on, the communication, because sometimes, because of course English is not our first language, so sometimes it takes time to get the pace. Okay. So start speaking, okay, start rehearsing, start practicing. So you are going to be in the flow. Start take help, they taking help from any of the, the mentor, take any course. So it is going to be good for you. And this is another, the $1 million question. What is being asked, the quite often, that how much time is enough? Believe me, if you are good, if you have just passed your exam, total of 3 to 4 months study is enough to pass this exam. Okay. Because as long as you are going to delay this exam, what will happen is that you are going to get new TOG article. You may get, the new guidelines as well. So you have to study a lot then, isn't it, apart from whatever you have studied? So what will happen is that if you will delay for this exam, okay, if the reason is genuine, if there is any, the other reason for which you cannot go for this exam, so okay, that is doable. But if you really want to go for this exam, so take just 3 months, and I think this is doable. All right. And one of my student, I really want to, the comment on this, that she passed exam in this, the last, sorry, may 2022. She passed her theory in January exam, like all of you guys, and she took, the my course, and the she didn't go here and there. She was with me in part 2, then she was with me in part 3, and today she is working at NHS. Okay. So it all depends upon, the how focused you are. And she was such a dedicated girl, such a hardworking girl, that she used to take every task, she used to take every, the kind of responsibility, every task, anything. She didn't used to miss any class as well. Okay. She was very punctual. And see, the hard work, only I think 2 months and the 25 days, or you can say that 22 days or whatever, total 3 months, this way or that way. Okay. But she sailed through. Trust me, it is doable. It is very much doable. If you really want to stay focused, if you just want to, the start your preparation for May exam, so start it from today. Because this is what I say, that the road to success and the road to failure are almost exactly the same. Okay, because this is the same road. Okay, why we fail? Why we pass? Sometimes in part 3, what happens is that the difference is going to be the correct and the focused guidance into the right direction. This is very much important, because for part 3, because unlike part 2, because part 2 is very diverse, even if you don't take any guidance, you can pass yourself as well. Okay. But for part 3, you need to understand what exactly the part 3 is, how much, there is going to be, the hurdles, what are going to be the most, the commonly asked questions, stations, different phrases, how you are going to work on your tone, your pace, your choice of words. So this is only going to be done by the focus mentoring. Okay. And this is where, the sometimes, the we as a med exam team help. Okay. So we do have, the one-to-one courses as well, one-to-one mean one mentor. And like for me, I take, the very very small group of people, like 6 to 7 or maximum 8, and I just coach them, I just teach them. And then there are going to be mock exams as well. And of course, we are open for one-to-one courses for the my exam. And I have already started, the batches. So if you guys, any one of you is interested, so you guys can enroll with me. I'll be very happy to be part of your success. And I let me assure you that, I will be guiding you in the correct, the direction. All right. So we have had, the very good result for part 3 so far. Okay. And we have, the number of people who are working in NHS at the moment as well. So yes, it is going to be a very good journey. All right. So what you are going to get, you are going to get, the session schedule, recording, study groups. And for example, like I said, that I take, the small number of, the people group. So yes, you will get chance to present in every session, intensive feedback, of course. Okay. Limited number. So it is going to be a very beneficial. So this is me, right? Dr. Zaib Qureshi. So of course, the mocks get filled quite early. So if anybody is, interested, can book with me. So I will give you, the mocks, the accordingly. And of course, this is going to be a very good preparation time. So anyone who is interested can get in touch with me, with mid exam team, anyone. I'm open, I'm always available here and there, Facebook, Telegram, WhatsApp. So anyone who wants to, the interact, anyone who wants to have, the guidance as well, we do provide, the some kind of, the counseling session as well, that okay, are you ready for this exam or no, whether you want to take, the break, or whether you want to take, the some more time to prepare for this exam. Okay, so everything is available. So just start over. All you need to do is, you just need to start. All right, so start over. Don't just, the sit and wait for miracles. Those are not going to happen. Okay, because, the exams are being, has always been so competitive, but because of a lot of competition, it has become more competitive. Trust me. Okay, you must have seen part 2 result this time. Okay, it is so hard. It is so hard to believe that, the many good candidates didn't, to go through, and they just flunked with, the 1 or 2 percentages. Okay, you can see that, that RCOG is becoming tough day by day. All right, so before it becomes, the kind of unapproachable, so try to prepare yourself in a way that, you just go at least, they give you 100%, and nobody knows for the result, right? So at least you can give your 100%, and then, just the maybe, if you have done 100% good, or maybe you have done, the close to the pass marks, so of course you can pass. And we have got a couple of stories as well, in which, the people have passed in first go. Okay, this is not a, the kind of rocket science that you just need to go again and again, and you have to wait for 4 attempts. No, 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 like I said earlier, if one is good the prepared, if one is, the focused, you can say, and one is, very well, the going for the with very well executed, the study plan. So yes, it is quite doable. Okay, and 3 months are, I think, a good package to go through this exam. So what exactly is part 3? Let's summarize. It is going to be a combination of your knowledge, which is going to be blended with your communication skills. All right, clear everyone about, the domains and, the type of exam. Now we are just going to briefly talk about all domains, okay, one by one. So what is information gathering? Information gathering is history taking, right? In history taking, what we ask, history is going to be based on presenting complaint, and then history of presenting complaint. Presenting complaint is going to be what is going to be given to you. That patient has come with this complaint. Okay. Now your task is that you have to, the take her through the management plan, and you have to guide her through that how she is going to be treated. All right. So after history, what comes? After history comes, the examination. For example, in the online exam, or even face-to-face exam, you don't need to do examination. You can ask for examination findings. If you think that these examination findings are necessary to help you in your part, the management, then yes, ask for them. Okay, ask for examination findings, but otherwise don't need to, they do the examination. That okay, I'll do the examination, I'll do check the blood pressure, pulse, temperature, blah blah blah. Okay, so you don't need to do that, neither in the online and nor in the face to face exam. But yes, investigations are necessary. And then history should be very crisp, it should be structured and focused, and you need to use the less jargons. We call it as, it should be patient friendly language. So how you can improve on your patient friendly languages? By reading patient information leaflets. So all these patient information leaflets, we call them as PIL. Okay, in short form. I'm sure you all are well versed of, the how we all MRCG aspirants love, all these short forms. Okay, PILs, patient information leaflets. They are, the almost 53 or 56 available on RCOG website, and rest are available on NHS website. You can write anything on the Google, and then you can, write NHS. So plenty of leaflets will open. Okay, go through any leaflet, read, the patient friendly language. All right, so when you are going to start your history, greet patient. Hello, good morning, I'm Dr. Qureshi, I'm the doctor in the clinic today. Introduce yourself, take consent. Okay, I have read the case note that you are here to discuss about your, the biopsy which has been taken in the last appointment. Am I correct? Yes. Okay. So what am I going to do is that I'm going to, talk to you about the biopsy result, and later I'll talk to you about the management option. So would that be okay if I ask you a couple of questions? Yes, doctor. Okay. So we are going to start from history of presenting illness. Okay, okay. So Julie, so I understand that you had this biopsy, and can you just, tell me, what led you for this biopsy? Open question. Okay. So every history has got, the two type of questions: open question, closed question. Open questions. If you don't know anything, ask patient directly. How may I help you today? Can you please tell me in your own words? Okay. Okay, can you please tell me that how can I, the go through, how can I, the go through this, the investigations? Close question. Okay, ask one by one. Okay, so you had, the bleeding per vagina. Okay, was it heavy? Was it, the light? Was it with associated with pain? Okay, see, you are exploring everything yourself. Was it associated with passage of clots or flooding? Mhm. How many pads have you been changing in 24 hours? Uh-huh. All right. Is it associated with any dizziness or the any weakness or something? Yes, doctor. Okay. So apart from that, if you are asking from the patient, can you please tell me that what led you to this biopsy, or can you please tell me in your own words? So, you are going to ask about the onset of symptom, duration of symptom, progression, aggravating factors, relieving factors, if there is any association. Okay, so it is going to be like that. Then, after history of presenting illness, what we ask about past medical history, past surgical history. How you are going to ask past history? Okay, so is there any history of the prolonged illness, any hospitalization, or any history of the high blood pressure, sugar, or the clots in the legs or lungs? Have you had any kind of operation in your tummy or down below? Tummy or down below means abdomen and pelvis or vulva vagina. Okay, tummy and down below. Is there any family history of, if you want to ask about cancer, then directly ask. If there is there any family history of cancer of the bowel, womb, ovary, breast, or any part of the body? No. Okay. Then inquire about gynecological history. Gynecological is what? Gynecological history means you are going to ask about the periods, you are going to ask about cycle. Okay, so we say the sometimes the many role players, they don't like word periods. Okay, rather you can choose cycle. I think this is going to be a good word rather. Okay, so okay, how about your cycle? Is it regular? Okay, and normal? Yes, doctor. Do you ever bleed between two cycles? Intermenstrual bleeding. Do you ever bleed after having sex? Postcoital bleeding. Okay. You can say intercourse, you can say sex, anything is, the applicable. So don't be shy in asking this. Okay. Because these are very normal questions. All right. So like, me, myself, I'm very familiar, in talking about, the word this sex. This is common. This is norm for them. History of allergy. Are you allergic to anything, any medication or anything in particular? No, doctor. Okay. Tell me about your social habits. Do you smoke, drink, or do any recreational drugs? See, smoking is a normal for them, norm for them. Drinking is, the normal for them. Even doing drugs. So sometimes, if you really want to, because if it is normal, why you want to signpost? If you are feeling bad, this is you. Or if you really are shy in asking anything, so you can signpost in that, say, okay, so Julie, I'm going to ask you some of the personal questions. So is that okay? Yes, doctor. Julie, I'm going to ask the some of the personal questions which may be a little bit intrusive. So would that be okay with you? Yes, doctor. Okay, so do you smoke, do you drink, or, and pardon me to ask, any recreational drugs? Okay, because these are very much important questions. All right. So for me, I don't signpost because I think that this is very normal. Okay. But if somebody is hesitant, if somebody doesn't want to, the ask directly, so yes, signposting is okay. But for me, I want to, the save every second for my station, because in 10 minutes time, I really want to use them effectively. I will take almost 4 minutes in history, 1 minute in diagnosis, 4 minutes in management, and then 1 minute to conclude my session, conclude my that station, because I have to the complete the loop from the beginning to the end. This was a GP referral, this was a midwife referral. Okay, so I have to write back to GP. I have to give the patient information leaflet as well, because whatever we have discussed today, that is going to help her in the what you can say, deciding for the mode of treatment or the management or whatever. Okay, so personal history is done. Then socioeconomic history. Socioeconomic mean we are going to ask, what do you do for living, whom do you live with? Okay, that is important. And at the same time, you are going to inquire about domestic abuse. Okay, so you can simply say, if she is talking about her partner, okay, and then again, if somebody is talking about partner, don't categorically say husband, husband, husband all the time. Okay, because partnership or companionship is very normal for them. Okay, they live for ages and they are not married. So it doesn't mean that a person who are living together needs to be married as well. Okay, so don't they directly say that, categorically, in fact, that how about your husband or something. Okay, you can simply say partner. If she is introducing herself to you with yes, I'm Mrs. So and so, so yes, that makes sense that she is married. Okay, but if she's coming with the hi, I'm Julie Smith and blah blah blah, so okay, so call her with her, whatever she wants to be addressed as. Socioeconomic history. At the same time, when you have to exclude domestic abuse, you can say that how are things at home? Okay. Do you think that you make a happy couple? Do you think that you make a very the good couple? Yes, doctor. Okay. And yes, doctor, he is very supportive and he is very loving. Okay, that's brilliant. That's good to know. Okay. At the same time, you have to say something that okay, you are happy to know about that. Okay, that patient is having good environment at home. Mental health questions are very much important. So we are going to screen Woolies health question. Okay, we are going to ask that how have you been feeling for the last 4 weeks? Do you think that you have been feeling down, depressed, or not in doing the anything apart from this? This is what we feel all the day. But yes, this is very important for the patients, because these days mental health the problems are at raise. Okay, all around the globe. All right. So this is how we are going to take our history. Is it clear, everyone? Any question? Mm-hmm. Any question, guys? Please say something, yes or no, so I will move forward.
No questions.
Okay, very good. No questions. No question is also a good question. All right. So it means everything is clear. Clear. Good. Good job. All right. So from what sources are you going to use for all these the patient-friendly language and everything? NHS choices, like I have said earlier, you are going to read patient information leaflet. You are going to read the RCOG leaflet. You are going to take help from YouTube. You are going to take help from Vimeo channels as well. Okay, YouTube is a kind of university if you use it appropriately, trust me. Okay, for me myself, I used to take help from plab, the channels. I used to take from the take help from USMLE. I used to take help from the psychiatry for the mental health and blah blah blah. I used to take help from there are a lot of the plab channels, in fact, and USMLE channels. Then MRCP paces. Okay, MRCS. All right. So there are plenty of channels. If you utilize this YouTube, you can get the plenty of sources to observe. To you can even extract the good sentences. You can write it with you, and you can utilize them. You can utilize them while you are going to take the history. Trust me, it really gives very good impact to the examiner as well as to the role player as well. All right, this Vimeo it's also a the kind of video channel. RCOG has got its own channel on Vimeo. Okay, you can sign into the Vimeo channel, you can subscribe RCOG channel, and you can get the updates time to time. RCOG has recorded the plenty of good the videos on hysteroscopy, laparoscopy, consent taking, and I think there is kiwi delivery as well, forceps delivery as well, and tear perineal tear repair as well. All right. So if you can watch all these videos, I think you can get the plenty of help from all these sources. Okay. Apart from that, applied clinical knowledge. So yes, applied clinical knowledge is what? What is it is going to be that how you are going to manage the case, how you are going to interpret the investigation, how you are going to discuss the management plan, and how you are going to present a balanced view of the risk and the benefits of the intervention. For example, miscarriage has got the three types of intervention. Ectopic has got three types of management option. Okay, so we have got the expectant management. For the expectant management, in layman language, we say wait and watch policy. For medical management, you know, for example, if it is a the miscarriage, termination of pregnancy, we are going to say misoprostol. So yes, this is going to be abortion pill. Okay, or medical management with the help of medications. Surgical management with the help of the operation. If it is a topic, so likewise, it is going to be this. While you are going to talk about the all these management options, you are going to talk about pros and cons. Two pros, two cons, at least, and then you have to sum up. In the end, you have to ask the patients. So Julie, can you please tell me that which one of the treatment option would you be choosing for yourself? Yes, doctor, I think I'll go for the medicine. All right, so I'll write down in your notes and I'll talk to my consultant as well, and then you are going to tell her that how you are going to treat with the help of medication, this way or that way, but at least you have to give her all options. Okay. So of course, applied clinical knowledge are guidelines and TOG articles, right? So we have got Royal College guideline, we have got NICE guideline, we have got TOG articles as well. Then communication. Communication is very much important. Okay. If you're not communicating very well, if you are not actively listening, if you're not responding to the patient cues, so this is going to be a disaster. Okay, so if you're not if you're talking here and there, if you are using the jargon, full of jargon language, so it is going to be a disaster for you. Okay, so for example, like I said, that we have got the three treatment options, but that expectant management is good for her, so don't just be mummy or daddy to the patient. Give her all options. In the end, this is her life. In the end, this is what she has to choose for herself. You are no one to decide for anyone. Your job is to give the proper, accurate, and the appropriate the management options. Okay, so we don't have to I'm sure that we have read this terminology in the part 2 couple of times. Okay, so we don't have to be the kind of the parental uh, you can say that the input on any patient at all. Okay, doesn't matter if we know that she's breech, she's primipara, she's breech, and she just want vaginal delivery, and your task is to counsel her for emergency cesarean section. Okay, done deal. I know that according to guidelines for the primipara breech, yes, cesarean section is recommended, but patient is not willing to go for that. What you are going to do in the end, you are going to tell her each and everything. You are going to involve your consultant. You are going to shift her to the consultant care unit, and then of course you are going to tell her that look, although this is a good option, but for the the first time mom, this is not going to be a suitable option, because after delivery of the there can be some chances that the baby may have some kind of the injuries which are going to be inevitable. Okay, which are going to be somewhat the harmful for the baby as well, in terms of that we may injure the baby's organs may get injured, baby may have bony injury, baby may have some problem in delivering the head as well. All right, so your job is to give complete information with all pros and cons. Okay, in the end, this is patient's the choice. All right, and sometimes patient do ask, doctor, if you would be at my place, what would you be choosing for me? So don't fall for that trap as well. Don't fall for that trap at all right, so we are no one to decide for anyone at all. We don't know any circumstances, so you can simply say that look, the Julie, I am here no one to decide for yourself. Okay, because I won't be able to feel what exactly are you at the moment. Okay, so this is what you have to decide for yourself. Don't fall for that trap, that and say, okay, if I were at your place, so I will be choosing this. No, not at all, big no. Okay, so take informed consent. Informed consent means that consent, we all know that a person is able to understand, comprehend, and then a person is able to repeat whatever the knowledge has been provided to her or him. That is called as the informed consent. All right, and this is very much important, that if at all you need to do examination, so make sure that you are the ensuring patient, you are ensuring confidentiality as well at the same time. If you are going to go for intimate examination, so say, I need to examine you. I need to examine you from your tummy, from your down below, and with the presence of chaperone. Okay, so it is important. And the maintain dignity. If you feel that patient is shy, if you feel that patient is not willing to go for, you can simply say that, look, Julie, whatever you are going to discuss here is going to be purely confidential. Nobody will ever come to know, until and unless you are going to allow me to do so. All right, confidentiality is must, and the maintaining dignity of the patient is must as well. All right, then comes communication with colleague. Communication with colleagues is that what are your the responsibility. For example, you are ST3, ST4, like I said earlier with the example, you have been asked to perform the vaginal hysterectomy. Of course I cannot perform because I'm ST3 only. All right, so I'll be involving my consultant. For example, the patient has just been diagnosed with this, the hyperthyroidism in pregnancy. So this is not my domain, so I need to involve, the endocrinologist who is involved, who is a specialist in dealing with the thyroid disorders. So that is going to be a multidisciplinary team. You are going to involve your consultant. You are going to involve, for example, if it's an epilepsy neurologist, okay, you are going to involve the epilepsy nurse. You are going to involve the anesthetist in the later half of pregnancy, neonatologist, or the baby doctor as well. Okay, so at least you need to name them. Midwives, if it is GP, so write back to GP, because GP is a cornerstone in NHS, in the healthcare, the system. All right, so you have to write back to GP, and you have to involve anesthetist, you have to involve neonatologist if at all it is needed. Okay, so that is termed as communication with colleagues. Patient safety will start from the moment patient will enter into the cubicle, or you are going to enter into the cubicle. Patient's name, her age, pregnancy, living status, last menstrual period, BMI, smear history, contraception, what medications are you prescribing her? For example, pethidine is contraindicated in sickle cell disease, in sepsis, in OHSS, and all. All right. We don't want to give pethidine in epilepsy as well. So if you are not, the uttering this, so it means you are failing 1 point. So who knows that this was the major passing criteria in that station? Okay. So patient safety is going to be judged in almost all station there is. The most important is this domain is very much important to pass. Okay, so sometimes try to be a safe doctor, like I said earlier. MMDT, risk management, if at all it was a kind of the complication that has been done by one of your colleague, don't undermine that colleague. Don't say that, okay, he was not capable enough. Okay, whatever has been done has been done. You need to understand that you have to do the incident reporting or DATEX filling. DATEX is web based, and incident reporting is going to be the paper based. It's the same thing. Okay, then starts the exam time. What you are going to do in 2 minutes? 2 minutes is nothing. 2 minutes will just pass like this. You need to read your task carefully. You need to check what domains are being tested in this task. Don't start making keys. Okay, I'll start from my station there. I will ask this, I will ask this, I will ask this. And in this chaos, you will, forget what exactly you want to do. Okay, check it's a referral or not, because you have to close the loop by sending her to the GP, to the midwife, or to another specialty. Formulate how will you start the station. Read questions again and again. This is very much important. In 10 minutes time, look confident, enter into the cubicle calmly, familiarize yourself with the cubicle, because it is important as well. Like I said earlier, if it is the one person and you, it may be a ST task. Okay, there are the people across the table, two people across the table, and this is you. So it must be a role player, and it must be an examiner, and this is you. If there are three people, so expect that this can be a lay examiner station as well. Lay examiner will always be a kind of the tricky station, so expect you need to work a little bit extra on your communication. So just focus on role player. Try to finish your task with respective domains. If you have finished your station before the bell rings, sit comfortably. Don't change glances with anyone in the cubicle. Just be yourself. Okay, don't look here and there. Now this is another $1 million question: how to start preparation. Organize yourself. Plan when it is feasible for you. Make a schedule with your the job and the household responsibility. Look for a good study buddy. who is ready to take burden of this tough schedule with you, who doesn't undermine you or make you feel inferior. Because all of us have got, the different scenarios, different, the, you can say, circumstances. Many of us are very good in communication, many of us are very good in applied clinical knowledge, but they are shy in speaking. Okay, so sometimes it takes time to go into the flow. So I will advise all of you guys that please start from today. Okay, so the join anyone, and the start it, start over. Start is always hard for part 3, trust me. Make templates if you really want to and revise them in the end. Do available stations and the books and then at least revise them. According to your feasibility, 2 online courses are enough, and even 1 or 2 is enough. And if time allows, then 1 or 2 on-site courses as well. Because on-site courses will give you complete, the circuit preparation. Okay, regarding exam from 1 to 2 to 3 to 4, 5, and blah blah blah. Okay, this is how it is going to be done. Or the online mocks as well, like I conduct, like many of the mentors conduct at med exam as well. So you can book the online mock or the on-site mock as well. You can book our the online courses as well. Master on your communication skills and revise your syllabus. Okay, so communication skills of course are going to be the master on once you are going to perform, once you are going to be corrected upon, once you are going to be heard by, okay, any of the mentor. If you are not going to perform, if you are just going to be shy, if you're not going to speak, if you're just going to be the, you can say, the spectator, so of course this is not going to help you. In part 3 you need to speak, 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 and speak. All right. Curriculum is same as part 2. Yeah. Teaching, core surgical skills, post-operative care, gynecological problems, sexual and reproductive health, subfertility, early pregnancy care, antenatal care, postpartum care, maternal medicine, labor and delivery, clinical governance topics. Out of them, you may get an audit, you may get the risk management tasks, you may get the any of the thing. All right. Bullying, undermining, it is very much important. So this is going to be the curriculum, and books to be done on priority. Okay, so we have got at least 5 books in our the market. So this is by the RCOG Lisa Joel book. This is part 3 MRCOG Essential Revision Guide. You can start from here. The first 3 chapters are going to summarize what I have discussed today. Okay, it's going to be almost same. So if anybody who wants to get the guidance, you can get the hard copy or the the soft copy as well. Almost every book is available on the Telegram groups, and even in our parts, MRCOG Part 3 guide group on Telegram as well. You can join and you can get all these books there. And if you want the hard copies, so anything is up to you. Then this book has got the good number of tasks, almost the 90 tasks. In this book, almost 50 tasks. This is get through almost 14, 14, 28, and 6, 34. This has got the 5 papers, and it has got almost 90 tasks as well. So if you rehearse and in here 18 tasks. So you can see that if you add all these, so they make almost 200 plus questions. 200 plus question means that you are rehearsing, you are revising your stuff, you are memorizing them again and again, and you are, of course, the mastering on your communication, mastering on your applied clinical knowledge and all. All right. So this way or that way, it is going to give you plenty of, the rehearsal. Apart from that, if you are enrolled with, the us or, with group study, so of course you are going to get, the plenty of rehearsal, plenty of knowledge, because the all of these stations are, and many of the past exam questions as well will be done in the online sessions and in the closed group on Telegram, WhatsApp. Okay, this way or that way. So I think this is going to give you the good idea that how to go for this exam. All right, clear everyone? All right.
I'm sorry, excuse me, I can't hear you. I don't know whether it is something wrong with my side or your side.
Okay, sorry. Is it okay now?
Yeah, that's all right.
Okay, I'm sorry. It was from my side somehow. I muted myself.
It's okay.
All
It's
right.
okay.
All right. So we are going to start our history. All right. So antenatal care and maternal medicine will overlap. Let me repeat again. It will overlap. So you have to start taking history. You have to ask for presenting illness, history of presenting illness. You have to start the patient from medications in current pregnancy if she is on time. Then you have to take her through the investigations, time and mode of delivery, multidisciplinary team, how she is going to be managed, how she is going to have her, the all visits and everything, what medication you want to start her on. Okay, so all these things are going to be there. You just need to justify. Remember in part 3, you want to ask anything, justify why I want to ask. If you want to, prescribe her with any medication, why you want to prescribe her with any medication. Okay, if you want to go for an investigation, why. So just justify, justify, and justify. This is all what part 3 is. Like in urogynecology, in this module, you need to cover history, associated symptom like sexual symptom, bowel symptom, urinary symptom, menopausal status, work if she is lifting, the heavy objects, smoking, fluid intake, chronic cough or constipation, anything which is increasing the intra-abdominal pressure, BMI, fertility wishes, because we know theoretically that all these things are going to start from her fertility wishes, that whether she wants to, reserve her fertility, whether she wants to, the doesn't want to preserve her fertility. Okay, then couple of options. Then teaching module is going to be same, but in this we are going to speak to our junior colleague. Okay, so in this you are going to identify the level of your candidate, build up a rapport, start with theoretical part. For example, if she wants to learn about the pessary insertion, if she wants to learn about the episiotomy, if she wants to learn about, the vacuum delivery or forceps delivery, so yes, inquire the background knowledge and then go about it. Then check understanding time to time, offer learning resources like workshops, web research, courses, ask candidate to give you feedback. And the later, many of the time, you will get MRCGP trainee who is here to learn about the pessary, who is here to learn about the episiotomy, type of episiotomy, who wants to learn about the CTG. These days, two, three hot topics are there. CTG teaching, because we all know that in December 2022, they have revised this fetal monitoring in labor, right? And now CTG has completely been changed from, the reassuring, assuring, the features. Now it is white in color, amber in color, or red in color, right? And the management is almost same, but somehow it is little bit tricky now. Okay, so you need to understand that you need to follow new CTG. Okay, if at all you haven't studied, so study it. Sexual assault teaching is there. Okay, then we have got, the pessary teaching, we have got episiotomy teaching, we have got perineal tear repair teaching, we have got, the MDT letter teaching, we have got referral letter teaching, we have got, the discharge letter teaching. So many, the very, very, you can say the hot favorite topics by RCOG. Okay, these two are top of the list these days: CTG teaching and sexual assault teaching. Okay, it means that you are teaching to your junior colleagues. Likewise in oncology module, so yes, it is going to be a very tricky module in which you have to show your all skills, communication knowledge as well as applied clinical knowledge, because in this you need to show that how the good empathic doctor you are. Okay, you really feel the pain for the patient, you really want to help her, you really want to tell her the good best option for her, which is, again, if there are plenty of options, tell her all options, one, two, three. Okay, in the end this is her right to choose for herself. Okay, but you need to be very the good. Okay, you need to be very thorough in your communication, and that is only going to be done by if your applied clinical knowledge is good. If you don't have any background knowledge, so of course you are going to be lacking in your the communication as well, what you are going to talk to the patient. If you are the prepared in the 3 months time, then yes, prepare for your big day. That's it. Go for exam, then wait for your result, and if you pass this exam, okay, then yes, you are ready to go for your convocation. I hope the things are clear to you now. That, but trust me, for this part 3, practice is must. Practice with the schedule is must. practice with, the stations, practice with, the mentor is must. At least you need, the focused guidance. You need correct guidance in the right direction. All right. So practice, practice, and practice. Any questions? So this was all for, the part 3. I hope I have been able to, declare all these queries about part 3, how we are going to go about. Is it clear, everyone? Mm-hmm. Oh, very good. Very good. Thank you, Azba. Thank you. All right. Very good. Any question? Mm-hmm. No question? Okay. Namal, Ola, Azwa. So Azwa had just said, Manikam, Ishaq, how are you? Grace, Nasreen, Mahmuda,
Yeah, that's
Kuratulen,
right.
Asma.
Actually,
Fine, ma'am.
I just participated this one, but I'm getting ready for part 2.
Uh-huh.
Just here to listen what is going on. Right?
Okay.
Can you just give me a little advice regarding part 2, if you don't mind?
Uh-huh.
I
Yes,
know this
yes,
is
yes,
not
sure.
this is not the place to ask this question, but still,
No. Definitely. For part 2, of course, if you are aiming for July exam, so it's better to start from now. Okay. So
yeah,
part two curriculum is bit vast. Okay, you have to cover all green top guideline, all nice guidelines. You have to cover plenty of talk articles as well, because the syllabus is same, because you have to study according to the modules. All right. So
okay.
the all these things needs to be on your tips. For part 2, of course, it is going to be theoretical. So the part 2 comprises of single best answers and extended match
Yeah,
questions.
yeah,
Okay. So if
yeah.
the extended match questions are there, so that needs plenty of the rehearsal. Okay, Namal.
Okay,
So I will
okay.
advise you that if you really want to go for part 2, so start preparing from today. Don't waste
Yeah,
time
okay.
and be part of our the MRCOG part 2 guide group. So we do have dedicated schedule, dedicated the study pattern. We do study on the daily basis. Okay. We do have
Yeah.
plenty of free the groups as well as paid groups as well. So any of you any of you want to be part of, so please do join. All right.
Thank you very much. Yeah.
Okay. Okay. Very good. Thank you. Uh-huh. All right. So, okay, Annie, very good. Mm-hmm. Mahmuda, Dasreen, okay, very good. Asma, very good, very good. Grace. Mm-hmm. Okay, brilliant. Thank you so much. So, anybody, if somebody has any kind of query, any question, anything regarding, the
Yeah,
exam, the pattern. Yes, yes.
yeah. Thank you, ma'am, for the nice class. Yeah. So one question actually regarding the actually type of exam,
Mm-hmm.
like Oriel, do you prefer, like, is there any pure advantage of taking the exam face to face, or Oriel, what do you prefer actually? Is there any?
Mahmuda, I will suggest, sweetheart, that choose according to your feasibility. Okay, because it is important. Because this exam needs a lot of financial resources, isn't it? First of all.
Yes, ma'am.
So
Yes.
secondly, okay, then the second is going to be online exam needs a lot of the good internet. If you think that the place where you live at, it has the good speed internet, so I think online exam can be good for you. Okay. The second thing is that traveling to out of the station means out of your country. If I'm not mistaken, you're from Bangladesh. Okay. So
Yes.
Bangladesh
Yes.
and Pakistan, we both are not exam centers yet. So of course you have to travel. You have to travel to either. Okay. Now there is another news that the May exam is going to be in UAE as well. So if candidates, for us, we can travel to UAE easily, all right? So we can go to UAE, we can go to, the Singapore, we can go to UK as well. So it all depends on, sweetheart, it all depends upon, the number of, the things, okay? Number of things means, the first of all, financial aspect. Second, the traveling stress, okay? If you think that you can go and you can, adjust over there because of the weather as well. Sometimes, the many people, they get sick over there because of the weather change. Because we are familiar with the hot weather, and UK is pretty, the kind of cold, even in the April, May as well. So it is going to be like, 12 to 16. Okay, that is going to be the temperature. So this is how, the things goes. So in terms of preference, it all depends upon what you choose for yourself. Okay, because I won't be a good, the person to suggest, because exam is same, be it online, be it face to face. Okay, be it online, be it face to face. So exam is exam. So if somebody is saying that no, there are high chances to pass from online exam, trust me, he or she is misguided. Okay, because exam is going to be same for all candidates all around the globe. You got my point? Okay.
Yes, ma'am. Yes.
Even, this time I think Egypt is also center. See, we have got Egypt, we have got India. In India we have three centers. Okay, I think Chennai, Calcutta, and Delhi. All right. And then in UAE there is going to be one center. In London there is going to be center. And Singapore, Malaysia, or Hong Kong, either of them. So they keep changing, because that is, the East Asia. So of course, the one of the center is going to be there as well. So I think there are going to be plenty of centers. So I will suggest, sit and, the calculate and choose. Write down for yourself what are going to be the pros for me, what are going to be the cons for me. So I believe this way you can choose best for yourself. Okay, if you feel
Okay.
that there is no internet glitch at your place, and you cannot afford to go outside, because sometimes, many candidates, they are afraid of solo traveling. They want
Yes.
companion. Okay, sometimes they want to take their parents, sometimes they want to take their sister, brother, or husband, or the sibling, or the daughter, son. So that costs a lot as well, isn't it? So I mean, traveling is not easy these days at all, keeping in view of current inflation. So make sure that you are, the thinking in right way, in the right direction for yourself too. And if you have planned for yourself for online exam, so I will suggest for that be at the place where you have no internet connection, there is no electricity problem, because India, Pakistan, and Bangladesh, we do face electricity problem as well. Even in Nepal as well, we do face, the electricity issues too. So make sure that you are having alternative system in place. Make sure you have, the 1, 2, 3 strong internet connections in place as well. Okay. So if
Okay,
everything
ma'am.
is good at your place, so I think online can be a good option. But if you can travel, that can be a good option as well. I mean, there is no hard and fast rule that, okay, yes, I have to go for this exam, I have to go for, the venue, or have to go for that venue. All right, Mahmuda.
Yes. Okay, ma'am. Thank you.
Okay, brilliant.
Ma'am,
Okay.
sorry,
Mm,
I'm Arati. I joined the session just 5 minutes back,
mhm,
so I
mhm.
missed the entire presentation actually. I
Mhm.
wanted to ask you, like, from where we need to read for each station.
Well, sweetheart, let me tell you that it is not basically reading, it is basically performing. Okay, so
Mm-hmm.
just let me tell you the sources from where you can, the perform your stations. So we
Mm-hmm.
have got 5 books. Okay, we have
Mm-hmm.
got this Lisa Joel book, we have got Oxford Specialty Task book, we have got Tony Hollingsworth, we have
Mm-hmm.
got The Get Through, we have got this Justin Cooney
Mm-hmm.
book. Okay, so like I have roughly calculated, because I know this is syllabus very well. So almost 90 cases are here, at least 18 cases are here, 50 cases are here, 34 cases are here, 90 cases are here. 90
Mm-hmm.
cases means that you are reading all these topics thoroughly, you are performing them, and you are, make sure that you have, the good time management as well. 10 minutes time is good time. Okay.
Mm.
4 minutes for history. Okay. 2 minutes for
Yeah.
diagnosis and, the explanation. 4 minutes for management, and 1 minute for, closing the loop.
Okay, ma'am. So you are telling to read these books first.
Uh, Sweetheart, I think you are missing out here, that, we don't have to read anything. Okay.
Mm. Mm.
First, you need to understand the essence of this part three. Okay.
Mm.
Make sure that you listen to this audio later on. Okay. It will be uploaded on YouTube. And if you can
Okay.
just send me message on Telegram, I will send you link personally. Okay. Once it is
Oh.
ready and uploaded. But there is no reading as such. There is only performance. You can, to perform. For example, you will be given a task on cystic fibrosis in here. So you have to read cystic fibrosis in depth. And what source you have? CROG article. Okay.
Mm,
For example,
mm,
you have to go for a station which is inflammatory bowel disease. So what sorts you
mm,
have? TOG article. You will quickly go through TOG article and then you will perform. At the same time, when you are talking to the patient, you need to read complete clinical knowledge into the the patient friendly language, and that is going to be done by the patient information leaflets. All right.
mm.
Okay. So all
So
these
all
books
this
are available.
material, yeah,
Mhm.
so all this information, like for example, patient information leaflets, everything is this in this books, or we have to Google it.
Patient information leaflets are present on RCOG website and they are present on NHS, the different hospitals. So you can
Mm,
just write down whatever you want on the Google and then you can download. It's freely available everywhere. Okay.
mm. Okay, ma'am. Okay, thank you.
Okay, very good,
Mm.
brilliant. So to conclude my session, I will again, to say if anybody is interested in, the enrolling with me, you are more than welcome, and I'll be more than happy to be part of your success as well by the end of, this MRCOG journey. So make sure that you are, getting connected to me or any of my team members. Okay. So all the very best. Start over and don't look back, and this is pretty doable. If I can do it, certainly you can do it as well. It's not something that out of the world. Everybody can be a MRCOG. It all needs persistence. It all needs dedication. It all needs the hard work. That's it. All right.
Yeah, thank you very much.
Okay, well done. Thank you so much, everyone, for being, the patient and listening to me. So, inshallah, I will see you guys in the some other session. And these are the course details, and the numbers are here. You guys can get in touch, and even for any guidance as well. We are here to guide as well. All right. All right. See you, inshallah, some
Yeah,
other time.
okay.
Bye bye. Thank you.